Good morning, doctor. Welcome to this interview.
Good morning, madam. Very nice to see you in the morning.
Thank you. Dr. Shrikrishna Katneshwarkar. He has completed MBBS, MS, and specialization in GI surgery. His personality is just like his name, Sri Krishna, a famous king of mythology and also considered as a god. Dr. Sri Krishna Katneshwarkar's personality traits match with Lord Sri Krishna. He's very clever, justice provider, honest and modest, follows righteousness in his practice. He's compassionate and passionate about his profession. He's an effective communicator, counselor, and mentor to his patients. He has mastered the knowledge and skills of his domain specialization. He is a versatile doctor, husband, father. He is blessed with two daughters and a son. A son and daughter are doctors, and one daughter is an engineer. His wife is a popular dentist. Dr. Katneshwarkar has 36 years of experience in his profession. An effective gastroenterologist.
Yeah.
What is the
Yeah.
subject it deals with?
See, the area just below the chest and above our legs is called as abdomen.
Yeah.
Traditionally, or in mythology, it is called as magic box. So, so many investigations are there to understand what is there inside this box. But still, it has become mystery in most advanced age of medical practice. So diseases related to abdomen, those which require surgery, then that branch is called as surgical gastroenterology.
Okay. So mostly it deals with the digestive system and related other
Digestive
organs.
system, yeah, definitely.
Okay.
Digestive system organs. Then it includes the coexisting organs, that is which help digestive system, that is kidney system is also there.
Okay.
Then what is called as retroperitoneum, that is also involved in abdominal diseases.
Okay.
So a complex set of different organs working together, and then you have to diagnose and deal with either medically or surgically. The branch is called as gastroenterology. Yeah.
So the one who is specialized in that is gastroenterologist.
Either medical branch or surgical branch.
Okay.
Yes.
Can you just throw light on your childhood? Where were you born and which year and who were there, your parents?
I was born in 1960.
Uh-huh.
My parents, my father was a lawyer here in Parvani.
Okay.
Yeah. Then my mother, she had education up to 10th standard. She comes from very good educational background family.
Okay.
My father comes from remote place, but he was the only person in siblings who got educated and did his law. So
Those days lawyers had a lot of social status.
yeah, not only social status, they got maximum respect also
Yeah,
in society.
that is why.
That's why he was almost known to everybody in Parvani.
Yeah.
He was very famous.
Mm-hmm.
I was born in 1960 in Vadgalli, the hardcore city, birthplace of Parvani,
Okay.
very
Now-
near to Nanalpet.
Uh-huh. Now Parvani is expanded in our
Yeah, very much
ideas.
expanded. And
How many children, siblings you were? How many sisters and brothers?
I have two sisters and one brother.
Okay.
One sister got educated, we all got educated in Parvani only.
Okay.
The elder sister, she was more into music. She had very good voice, and she was the main singer of Shivaji College that time in 1965 to 70.
Okay.
Elder brother, he did his engineering 12th standard examination, the course in Parvani, and then in Aurangabad he did his engineering and pursued that engineering career. The younger sister, like me, she is doctor, she is gynecologist, now working and practicing in Pune.
So your education was throughout till 12th standard. Was it in
Parvani,
English medium or Marathi?
Marathi medium.
Marathi.
Bal Vidyamandir was my school.
Okay.
It was the actually first batch where Bal Vidyamandir proceeded from first standard to 10th standard.
Okay.
1965 to 75. 75 or it's the original first batch of Bal Vidyamandir,
Okay.
where new syllabus was introduced. 10 plus 2 plus 3.
Okay.
So educational journey, if you look at the premises, it started with very primitive underdeveloped premises
naturally.
to this present
First
well
batch means
developed,
they have limited facilities also,
Yeah,
because it's
yeah.
in budding stage.
Yeah.
The school is.
Yeah.
At what age you decided I should become a doctor, or just it was a coincidence?
Right from beginning, studies was no problem. So our family, my mother, parents, or we all were knowing that we are going to become something, either engineer or doctor.
Okay.
So intelligence was not issue, but a great incident occurred in our life. My elder brother became engineer. I lost my father at a very early age. I was 11 years. My brother was 15 years. My younger sister was 9 years only. And he died of some stomach disease in Parvani only. So my mother was very much upset, and she was very much disturbed with that incident. And then she had that intense desire in her mind that my all children should become doctors now. So it was her intense desire. And then we had to take only efforts only and fulfill our wishes. And likewise we started liking this branch also. And that's how I became doctor, and that too in GI surgery.
Okay. Do you feel very proud that you have fulfilled the innate desire of your mother?
Yeah, definitely.
And did she
Then
see your practice doctor?
she used to say that no father or no parent should die in Parvani with your efforts. See, whatever amount of efforts you take for some diseases, you are not God.
Always your surgery should be successful.
But yes, surgery should be successful, and he should be alive and should go back to his home. That is not possible in every case, but she had that intense desire that I should give best possible services in Parvani through my son and daughter.
That is a noble intention of your mother. Not only just making a son as a doctor, but worried about the patient's life.
Yeah, definitely. She was always worried about patients and their caretaking, and she was very happy with whatever I was doing. And she was very much satisfied.
Is she there, mother?
No, we lost her in Corona period.
Okay, that means she has seen your practice.
Yes, definitely she has seen. We had our long
enjoyed Mama's care.
After father's death, we were there together for 50 years. She died at the age of 86. She has seen the total journey.
How was her health status?
She was extremely good till end.
Yeah,
because she was a profound follower of Ramdev Baba and Pandurang Shastri. Two things she used to do.
These two are enough. Yoga and self-study
self-study
makes a person healthy.
So she was doing yoga and everything at the age of 86 also.
Very nice. So you were brought up in a very disciplined environment.
Yeah, differently. She had altogether different personality. nothing for her, but she will concentrate on it. She forced us also to do the exercises, then proper studies, and then proper caretaking. What she expected from us is that only you are expected to do very good services. Whatever money or the professionally you will get,
That is
that
secondary.
will come automatically. She was not crazy for any type of earning for herself also and not for we doctors also.
Where did you do your MBBS and MS? Doctor, where did you do your MBBS, then later MS?
I had my 11th and 12th from Shivaji College, Parvani.
Parvati.
Then with good marks I could enter the Government Medical College, Aurangabad.
Was
It was the
there
only one opportunity that time.
was
Only
there entrance exam or just based on the merit?
based on the merit of these three subjects,
Science, biology.
the biology, chemistry, and physics.
Okay.
That group, and for mathematics, physics, and chemistry.
Okay.
Like that, the admission. This was the first batch of new syllabus, 10 plus 2 plus 3.
Yeah.
So for us, it was a experiment for teachers also and students also.
But did they pay more attention to the new syllabus?
They were also not aware of the overall total system.
Mm-hmm.
So there were some directives, but they understood over a period of time.
Okay.
But in for first batch, it was almost experimental.
So
But somehow I got accustomed to that system so fast, so I could produce good results and could get easily admission at Medical College Aurangabad.
how many students of your batch went for MBBS? Do you remember?
From Parvani, four, yeah.
Okay. Then what was the duration of MBBS in those days?
Now also it is same,
Same.
4.5 years. Yeah.
4.5.
Right from beginning it is 4.5 years.
Okay.
Yes.
Then what motivated you to go for MS?
My original desire to become the stomach specialist is one, and then I was fascinated by my maternal uncle's practice. He was MS that time. He was master of general surgery. Then I had the opportunity to see his work and to continue our own desire. Then interest in the subject forced me to take this subject and excel into that.
Where did you do MS?
Same Government Medical College, Aurangabad.
That time it offered even MS also.
Yeah.
Okay.
Yes. That time system was that moment you top in one subject out of 5 subjects at the third MBBS, you can get easy admission in that particular subject.
But what is yours was the first batch even for MS? No. Already it was
No, there was the pretty old college, medical college. Aurangabad was pretty old. There were so many senior surgeons or physicians. Or the mostly college started in 1965.
in whole Marathwada region, was it the only college?
Only college, yeah.
Government.
Yes, the government college. There was no private college. Only for total Marathwada, all admissions will go to government medical college.
Okay.
Yeah.
That's the preference.
Yeah, only preference.
Okay. After MS, have you done any specialization also? Or
Yes,
special
then I
training?
was very keen on getting trained in the one branch of surgery, that is GI surgery,
What is-
gastrointestinal surgery, stomach and intestine, digestive organs. So there was one famous personality in Mumbai, Dr. V.N. Srikhande. He was a world-renowned surgeon related to this gastrointestinal surgery. I had opportunity to work with him in Bombay Hospital, Mumbai. I worked there with him for 2 years, got myself trained. Then I knocked the doors back to Parvani for starting my practice in 1988.
Days, Honorable Vice Chancellor told me to show our clinic.
Yeah. He has very sharp memory. He inquired 2-3 times in phone also.
He was very much impressed
Yeah.
and true teacher, true researcher I could find. Even though I interacted with him for a few minutes.
Altogether very different personality.
And he had great praise for you also. He was telling
Yeah,
me.
yeah. I
Dr.
was lucky that I
Shrikrishna
was
is very
close to
intelligent student of mine, he was telling me.
Yeah. I had that kind of pleasure that I was very close to him, and then he came to Parvani many times for our medical and non-medical programs.
Because of you.
Yeah, the blessing I call it.
Yes, yes. Teachers' blessings are
Yeah.
always great. What type of challenges you encountered when you started practice? Whether people were aware about this gastrointestinal disorders and diseases?
No, people were not aware about gastrointestinal diseases. I had to work for creating awareness also.
Okay.
There were few facilities which I started first of its kind in Parvani. People were not knowing about what is meant by investigations,
Yeah.
what is meant by detailed checkup of GI diseases. So you have to keep on talking, making them aware about the knowledge of diseases and getting treated. So I had to work on that aspect very much. But slowly, people accepted so nicely. So I am getting same kind of pleasure which Dr. V.N. Sirikhande used to get uh, in Mumbai.
Okay. So the practice level has gone up to that level of
Yeah, definitely.
specialization.
That satisfaction
facilities.
level has gone to that level. I always used to feel why Bombay people are accepting this investigation, that investigation so easily. But now that is happening in Parvani.
So what type of efforts you have taken for educating the masses about GI? Was it in lectures through Lions Club or did you give any radio talks?
Radio talks I gave many times, and then people give the feedback that we listen to your talk. Then there were few articles published in papers also.
Okay.
But I don't feel that would help doctors for increasing or practice or creating awareness.
Okay.
See, one to one, that
Yeah.
communication,
Yes.
that helps.
For doctors, always
Yeah.
one beneficiary,
Yeah.
one patient getting success,
If
getting
you-
rid of pain, that at least that patient will tell 100 people.
Yeah. That is called as I call it as you practice as
Mouth
one
to
to
mouth.
one to. That's
Yeah.
all.
Mouth
You
to mouth.
concentrate on one patient or single patient.
Yeah.
You tell him whatever is necessary for him. That's all. That creates definitely awareness, and he will tell to somebody else.
That is a big publicity
Yeah.
through the patients.
Yeah.
And that is more realistic and reliable
Yeah,
information
definitely.
coming
Very
from
sad.
the beneficiary of
Yeah.
your practice.
Correct.
I remember 25 years back, I was coming that side for a lecture. Then I sat in my university vehicle. The driver was telling that like your lecture is arranged in that school near Dr. Katneshwarkar. I said, what is his specialization? He said, he's a superb surgeon. Ma'am, every auto fellow also knows because most of the patients from
Yeah.
railway station and bus stand, they are taken. And when the patients go back, they talk so much in auto. That's what, then that was, I was surprised to know the social auditing of a doctor, a common man like a driver, auto drivers, vehicle drivers were talking about your, commitment for your service. How did you develop your hospital? Basically, when you started, what facilities it had, and now what kind of advanced facilities are there?
To begin with, you have to go
General.
related to your capacity
Yeah.
in the form of managing capacity,
Yes.
then economical capacity, and need of the society. Basic instruments I had. You had to develop your own operation theatre, otherwise surgeon can't work. Then you have to develop some infrastructural development is necessary.
Yes.
Bare minimum necessity, what we understood at that time, see, these things are bare minimum necessity, and then we started accordingly. If you compare those that bare minimum facilities to present day practice, now hospitals are more like hotels. They are catering best possible services, and doctors are working in the hospitals organized by entrepreneurs. But that time, the one-to-one communication or patient's trust and everything was so good, so they were happy with what facilities we had.
Yeah.
See, initially 4 rooms, 5 rooms, then the ICU setup and everything was not that possible in our premises. So we slowly developed the culture of monitoring and ICU setup facilities, then advanced instrumentation, then changes in operation theater systems. So these came slowly.
Yeah.
The way we understood the necessity out of it,
Yeah.
and the economical backup also.
Yes. But basically, olden days, doctors' commitment, the quality of service they gave, even with the necessary equipment and facilities, the best care was given to the patients. But,
Yeah. The doctors, what I have understood throughout my practice, that what people want, they want very clear understanding about their disease,
yes, yes.
and that comes to only communication.
Yeah, communication.
The major drawback now in practice is that either patients are not listening to doctors very properly, or doctors are not having time
that
to
much time
explain
to
them
devote for
very
each
properly.
patient because of the queue of
Yeah.
patients.
Few of patients, the doctors are hesitant to explain in
Yeah.
detail.
Yes, yes.
Or when doctors are trying to explain, he is not
Passive
able
listener.
to
They don't
not
get
able to understand,
it.
or he doesn't understand the language.
Yeah.
So some communication gap is there. I am trying to overcome that gap, and somehow I am able to enjoy the practice and the relation between doctor and a patient.
What kind of diseases in 88 you said you started practicing? So now current health issues are the same and the incidence is more, or new health issues have come?
1988, I started my practice. That time, if we talk about stomach diseases, the ulcer was at very prime. Most of the patients were having what is called as duodenal ulcer disease. That was very common. And that
Reason for was
reason,
tobacco chewing?
tobacco chewing is very common almost throughout India, but in our area also tobacco chewing, then very spicy diet.
That was a major cause.
That was a major cause.
Spicy diet.
Spicy diet, and then abstinence from sleep, or
mental health
yeah,
issues.
mental issues, and so many reasons. What we put it into excess worry, 3 W's.
Yeah, excess.
Excess worry, excess work, and sometimes the weather also is not in favor of the general health care also.
Like
so we call it a W. We call sometimes the weather is something like this, that I feel that I will become sick.
Mm-hmm.
So weather.
Yeah.
So work, worry, weather, that affects your digestive system.
Which season? Is it rainy season or?
Not exactly, but you will sense it sometime. Yeah, could be very near to rainy season, but sometimes you feel that the cloud and everything is such that, so I am feeling something uneasy, and I am likely to feel sick. So that kind of weather, and then work, which is necessary or unnecessary work.
Yes.
Worry is necessary or unnecessary worry, whatever it is. So that www, which is there in internet, was there in our practice right from beginning.
Okay.
3 W's were there.
W's.
So that is what the 3 W's were the main cause of formation of ulcer disease.
Mm-hmm.
There was one drug which came out, that is called as omeprazole.
Mm-hmm.
That literally cured this ulcer disease. And then we almost stopped doing ulcer surgeries from 92, 93.
Okay. So the inventions of good medicine
Yeah,
also
yeah, yeah.
prevent
It has
surgery.
transformed completely the overall the progress of ulcer disease,
Very.
and that drug has done so wonderful job
Mhm.
thanks to that
Inventor.
invention. Yeah, great transformation in medical practice. So we used to do surgeries for ulcer disease that totally stopped completely.
What are the other health issues?
The in abdomen the main issues are appendicitis, as you know, appendix surgery. What we call it appendix is appendix is one vestigial organ connected to small and large intestine. If it gets infected, then we need to remove it. Then gallbladder is one organ related to digestive system. Sometimes they develop stones. Then intestine gets twisted on its own. Sometimes intestines gets blocked. Sometimes there is bleeding in the intestines.
Yeah.
So these are different surgical reasons where you need to intervene, observe, and they really require some kind of surgery, and then we expect cure from them.
What age group of patients generally they suffer from? Is it mid adulthood or teenagers?
Literature says gallbladder disease usually occurs post 50, and that too especially in the females. But we are seeing the mixed picture now. Even the youngest patient was 8 years old. For females who are in our books also it was mentioned that so 5F's fat, fertile, flatulent female of 50 was a proverb for formation of gallstones. If this criteria feels that this person, that lady will likely to have the gallstones. But the everything is changing. So the younger age group, the appendicitis is common. Older age group, gallbladder disease is common. Cancer, older age group is common. It is like that. Then variety of diseases are, but the age is now that criteria is fading away.
But generally, when I notice as a human development expert, the prenatal healthcare practices, they are ready to spend on medicine, but preventive measures like in teenage the girls do not eat well. Do you think the prenatal care, the preparation of the body when they enter pregnancy, is it related to this organ development and functioning?
Yeah, definitely.
Because olden days, hardly we used to hear because the women used to eat well. Even the growth index also, you see. Olden days, now they have stunted growth, very malnourished.
The olden days, the giving birth to a child
Was a major
was a major
responsibility.
responsibility and was considered as a ceremony.
Yes.
Somehow it has become a formality, I feel.
Yeah, definitely.
So
Even
you
I
need
do.
to concentrate on that issue very much.
Yeah.
Importance is given to the work pleasure.
Yeah.
But otherwise, the upbringing of child or giving birth to a child, I think that is the best possible work.
Yeah.
Because that's the best possible creation.
Yes.
So we need to concentrate on how it should happen, what kind of diet I should take, what kind of exercise I should take, what kind of books I should read.
Do you conduct any workshops or do the colleges, education institutions, do they invite? Are they aware that the student should be educated about, especially this GI health? Because mostly in general, when I talk to the students, they say I have stomachache, acidity. Every 5 students, if I interview, at least out of four out of 5 have acidity issue because of the irregular food.
Yeah. You almost answered the question because see, acidity has become a very common word. What is the definition of acidity? That changes person to person also.
Yes.
And the timing of the your lunch and dinner, then your sleeping pattern,
Yeah.
that everything affects on the production of the acid in the stomach.
Yes.
See, acid, hydrochloric acid is very essential for
Digestion.
digestive process. So excess amount of production of hydrochloric acid is called as acidity. But why it is happening? Are we keeping our stomach
Empty.
empty for long hours?
Yes.
Or we are feeding extra? Or we are feeding with
Less.
unnecessary products? Or you are indulgent to the work and the excess abstinence from sleep, and so we are not following the normal routine protocol of nature, then you are forced to develop that unnecessary work or worry, as I said. So that will produce more acid, and the acidity issue will come very regularly.
My observation and while dealing with students is either acidity or constipation.
Yeah.
Many complain that we get scared to visit the toilet because of the constipation issue. Do you find when you were teenagers, this health issue was never there? Or
Well, there the see
Or was it not addressed?
what amount of water we take,
uh-huh.
that makes sense. So if parents are not very
Health conscious.
health conscious related to how much amount of water their children should take, and he also should have that awareness that you should take maximum water content, and then the food quantity should be less, and the gap between food and water, and how much output in the form of urine is there, so that makes difference for even constipation also.
Mhm.
I think the main reason is less consumption of water.
Water, yes.
Yeah, that is the major problem.
Per day,
Especially
how many liters they must consume?
minimum 3 liters.
Irrespective of the age.
I would put it otherwise also. See, we cannot measure how much amount of
Yes,
urine
yes.
we pass every day, but it is expected that one should be able to avoid at least 1 liter, 1.5 liter, 1 liter to 1.5 liters. Then, if that output is there, so for that output, how much water I require? Is it 2 liters, it is 2.5 liters, or 3 liters, or 3.5 liters?
Yeah.
Then that awareness should be there. So if you are producing absolutely white colored urine, that means you are taking enough water.
Mhm.
So our urine should be white in color. So minimum 3 liters is a gross advice. 3 liters everybody should consume. To create awareness in our health also, the first important nowadays you can see through internet also, what is height and weight ratio. If everybody understand this height and weight ratio, then he will try to keep his health very properly. And then the 3 liters consumption of water, then weight standard is in this fashion, and whatever is happening in our life, day to day life, what we do, we get up, we go for washroom, we then eat, then we do exercise, we study, then we go to sleep. These are routine activities that everybody does. If something happening which did not happen previously, should be registered to doctor.
Yes.
All these routine activities. So I could not sit properly today. I could not get up properly today. Today I could take only 50% diet. So these are changes in your lifestyle.
Yeah.
Then you must register those things to doctor. To doctors, yes. That
Doctor, can you quote any interesting anecdotes of your practice while dealing with the patients, the outcome of surgery, any aspect of it?
you must have heard, I'll quote an example. The sometimes if some abdominal surgery is done, doctor or nurses or paramedical staff accidentally forgets the hospital instrument or that sponge we use for mopping inside the abdomen. It has happened accidentally, unintentionally, many times,
By
and
other doctors.
by other doctors. Then it was solved by other doctors also, and some patients are made comfortable. I had very rare example, answer to which I don't know to this date also. I had one case. Patient was operated 10 years back when I saw that patient for something in upper abdomen, that is stomach related surgery was done. Notes were not there. And then I saw patient after 10 years of his surgery. He came to me for pain in abdomen. I got him investigated and I started close observation, and I noticed that something is getting obstructed in his intestine. Then I opened the abdomen, and the surprise came that when I opened the intestine, I got intraluminal sponge. You can see sponge above intestine or in the general peritoneal cavity. In general abdomen, we see it occasionally, but this is never seen, never written in books, and never seen in the literature. Even you browse on internet, you will not understand what is this word intraluminal sponge, which I got in my practice and which I presented in different conferences also. And few teachers could not explain it why it must have happened. I had my logic, and then few teachers accepted my logic. Some of my satisfaction is that I could find that cause, I solved the patient's problem, and could present this very rare case in my conferences. That's my pleasure. So this was absolutely not written in literature, not seen anywhere. And then one more incident was there. A child came to me, the parents brought that child, hardly 12 or 14 months old. And they said that the child mostly swallowed a razor blade, part of the razor blade.
From the siblings one,
Siblings,
might be they might have dropped it at
sibling
home.
dropped it that child's mouth. Then we got the X-rays, and we were surprised that the blade was there inside. Then we did the what is called as gastroscopy under the anesthesia, and I could extract that razor blade. That is also not written in anywhere in the literature.
Incidences, rare incidences.
Yeah.
This might be because after 1 year, the babies, when they're crawling, whatever they see, they
So,
put it in their mouth.
without surgery, I could remove that. I have got very beautiful video of that
So
child.
this is a big lesson for the parents, that wherever the children are crawling and going around, small particles, small things should not be kept.
Yeah, I even tell that don't keep the change also,
Yes,
coins
yeah.
also, very near to each
Yes,
other.
when we were
It should be
children,
kept in unapproachable area.
in our colony, every year I used to hear that from other families that the child has swallowed 1 paisa. Those days, round one.
I must have removed more than 500 coins in my
That's
practice
what-
last 30 years through that gastroscope.
Yeah, because in my childhood I used to hear. We were very close to labor colony.
Yeah.
The kids, in
Very
the
common,
parental
yes,
absence, they pick up and they play with that, chew it and swallow.
A doctor's grandson swallowed a bunch of coins. I removed 3 coins at a time.
Like that is a
Very-
forenas one,
Yeah,
small,
but this is
25 paisa.
Yeah, he was hardly 8 or 10 years old. Then he, 1 coin is acceptable. Some by mistake somebody swallowed. But how come 3? He swallowed 3 coins.
What was the reason?
I don't know why say just playing some pigs and out of some heroic adventurous things.
Kids can do anything.
He was experimenting keeping coins in mouth. And he was saying whether it was.
That should be That practice should be, when they are children
They should
only.
be.
Anything, pencil, pen,
You should
chewing.
not keep it in.
Yeah, non-edible things
Only,
should never
no,
reach
no,
them.
only food items.
Yes,
That should be
non-edible
the
things.
lesson.
Yeah. I just have a question. You said your father was a popular lawyer, advocate
Yeah.
of those days. Generally, each parent feels, they have to carry on the legacy of their profession. Did he had any ambition? Whether
Yeah,
mother,
really,
because you were very young. But,
yeah, yeah. I have that good communication skill, and at times in school also I was good at debating competition. I was good at elocution competitions.
Mhm.
That skill was there, so which is necessary for lawyers.
Mm.
And then if you want to prove your side, I got my logic and the reasoning. So at times my reasoning was so good. So my mother and my father also used to feel that he should become lawyer.
Mhm.
I also like that profession. I attended court many times with him, but the his early passing away, then my mother's desire.
Yes.
So that entire liking and everything was changed, and then I started liking this profession and feeling good about giving whatever services I'm giving.
What are your hobbies other than your profession?
My hobbies are games and friendship. Friendship is my weak point. So I got a lot of friends right from childhood to medical career and this professional career also. Then with them I am involved in the carom, table tennis,
Mhm.
and cricket. Cricket I left now, but I am to the carom and table tennis is my passion.
Mhm.
Then I have a writing skill is there. I like to write many things. I am writing on my own experiences also.
Beautiful.
Yeah. Mostly I will publish my book in recent future.
How did you train your supporting staff? You are excellent as a surgeon. What role they play and how about this hospital staff? Was it good previously or now?
Like Bombay or Pune,
Uh-huh.
you won't get the trained or educated staff. So in our profession, uh, there is nothing like what is meant by substitute.
Yes.
So
there
doctors
is-
have to do that job
Yes.
right from seeing the patient, taking the history,
Yes.
and noting all those points. The writing work can be done by somebody else, but you need to
Yeah.
ask that patient, you need to communicate
Yes,
and then
yes.
explain him that doctor has to do. Then some procedures like gastroscopy, which I do, colonoscopy, that also you have to do it yourself.
Yeah.
Then surgery, cleaning part of the body, that can be done by assistants. Then draping part of the covering of the sheets over the abdomen, that also can be done by assistants. But right from incision to last stitch,
Yes.
that doctor has to do. So 90% of the medical work or surgical work doctor has to do.
Yes.
10-20% work you need to create that assistance.
But do
And
you?
somehow see, moment you develop family culture, the all those trained or untrained boys get attached to it, and somehow they get to know, understand the names of drugs also. Then the different infrastructural
Do's and
instruments
don'ts
and
also.
everything, and somehow they are trained now.
Oh.
So
But
they do a work to my expectations. Yes. Yes.
Can you give any 5 tips for the parents of school-going children for preventing this gastrointestinal disorders and diseases for school-going
For
children?
children, I would say, see, children, young persons, those who are working, and what we call senior citizens. So that's a different kind of package with everybody. For students, I would say that their first aim should be concentrate on studies only, for which they can develop their career, and then sleep pattern should be very perfect, and exercise and diet. All these four things, beyond that, they should do nothing. So they should concentrate on studies, diet program, diet that to maximum amount of water they should take, proper diet with intervals
Is
from
it
their mother.
food intake 3 times or 4 times is better?
Usually we say that stomach should not be empty for 5 hours. So I would suggest to school going children that they should take 3 times, should not keep their stomach empty, and take plenty of water, do proper exercise and study. Usually major gastrointestinal problems are not there in children. What they have is waterborne or airborne diseases. So if water intake is excellent, so the 90% diseases are prevented. So main caretaking is related to water.
Water and
I tell
hygienic
parents,
water.
hygienic water. I tell them you clean it the way you want it. You can do it. My mother used to do it. There were no hi-fi machines at that time.
Yes.
But she used to clean it very properly. So boiling is the best way of cleaning water, and it should be potable water. It should come from the municipality. Yeah. Water content and water hygiene is most important for children health. Then for working persons, they should work for their family, and then they should do exercise and sleep pattern, which is disturbing in today's lifestyle.
Yeah.
That everybody should
They go
concentrate
to
on
bed late.
at least
They
7 to
rise
8
also
hours.
late, very
8
late.
hours of sleep is a must. 7 to 8 hours sleep.
7
is must. And senior citizens, I would say minimum diet, maximum water. They should do exercises at home only, not outside.
outside.
And then they should involve into kind of activity which they like. That's all. Reading, seeing TV, or writing, whatever they want.
You have very successful both daughters and son. What type of upbringing then, as both of your doctors? Can you just say that these 5 things we really focused, like diet and whatever you focused while upbringing them?
I think I have to give credit to my wife because
Because
I
you
was
didn't have time
extremely busy in my practice.
But indirect care also.
Yeah, indirect care was there. They were very much attached to me right from their childhood. Uh, the madam, my wife Sanjivani, she really took very good care of her. She compromised her practice. She did practice only
And she
morning
was
hours
free.
only, and then she dedicated time to children, which was very necessary. She was very much firm about food at home only. She never allowed them to take outside food, or hoteling was very less in our family. And some of the children also were very much attached to us. They also didn't ask for something unusual. And some of the things went on, and they saw my surgery right from beginning. So
They know
they were
what to put and what
yeah.
not to put in the
So
stomach.
they were so fascinated, and they internally felt that they also should become surgeon. So my daughter, she became surgeon, and then got her specialization in Tata Hospital for breast cancer surgery.
Okay.
Yeah, and she is doing practice in Baramati now. And my son is about to become now surgeon. 2 months to go now. His exam going now.
What is his specialization?
He will be now he is called as MS General Surgeon. General surgery.
General surgery.
Yeah, he will be specialized to his branch which he likes. Mostly cancer surgery or GI surgery.
Okay, well, upbringing, you said parent-child relationships were superb.
Yeah.
Diet care was there. Outside food was discouraged.
Communication was I think what I feel that communication from madam to children was almost every day.
Okay.
They used to call or she used to call, so that was not a single day off from the communication.
What else?
Perfect communication. Then they
And
used
quality
to call
of education, study hours were they followed?
Yeah,
Study
they
hours.
definitely followed. Yeah.
Generally, the coaching might have been discouraged and they might have focused more on self-study. Their coaching might have taken wherever they required in some subjects.
Yeah, definitely. Yeah, coaching was restricted to the
Children decided, children
minimum
nowadays,
necessary.
parents, they have
Yeah.
so much program. After this one, when they are in seventh only, they are taking tuitions for ninth standard. Uh, ambitious and
Yeah, aggressive education
yeah,
program. Yeah,
that is
we
very
were not
very
into
bad.
that. Yeah, yeah.
You said beginning also,
Yeah.
even your mother,
Yeah.
even in your general suggestions, you said in whichever standard they are, they have to focus on that.
Yeah.
Diet, sleep, rest,
definitely.
exercise, these are very important. Otherwise, they'll end up with so many other health
Yeah,
issues.
the health issues are there.
Yes.
See,
Sometimes even they develop, disinterest in studies itself
yeah, definitely.
when we compel them so much.
That is the biggest problem
Yeah.
in children because the sleep pattern, if you don't follow the law of nature,
Yes.
so that deviation is going to occur.
Yes.
Somehow the children were listening to us very properly and we were forced to tell them all these law of nature and they used to take very proper sleep then proper way of studying and mainly our the communication was never interrupted. That's why we are able to see their roadmap to medical system and the whatever I wish that they should become surgeons.
Doctor,
So,
last question is, what Krishna in you, what that Sri Krishna was in childhood, in teenage, adulthood, what were the principles stayed with you over the period?
our family setup is like that. My mother is a staunch follower of truthfulness. She never used to tolerate lies. And then she forced us for doing exercise also. In childhood, she forced us me to do 108 Surya Namaskars every day. Then our family culture was such that we were love and affection was there. Then my weapon in my practice was truthfulness only. Then I got that idea that if I talk very correctly and very truthful to the patient, that will develop a length, the
Faith
wavelength
is
of
more.
trust only.
Faith
And if you
also.
develop that trust, so we don't have to see back now.
Yes, yes.
So that was my usually new doctors they are in hurry. There is some mad race in the society in every profession.
Yeah.
So
Wrong ways they adopt.
you're indulge into the speedy then achievements and all. But slow and steady wins the race. And we were our family structure was like that. We were never crazy for money or building up some so many facilities with us. So it was not like that. This was only services and nothing to earn. There was to proper earning by way of doing good practices. So that was the aim. And in my practice, I used to remember when I entered in Parvani, I used to remember always Dr. Dhamangaonkar and Dr. Bhalchandra, who were the best doctors in Parvani. They were known for their services. I always felt that I should be known in society and I should be there in hearts or minds. Always. That can happen only with your proper services, not with your professional business. So I'll put it in other way because it is my surgical branch. See, my teacher used to say, or I also feel like that, if a person lying on operation theatre, if you feel that he is not your brother, if you feel that he is not your son, if you feel that he is not your father, then something is wrong with your mindset.
So every
A
patient
lady which is lying on operation theatre, you
should
should feel
associate
that,
then he's
that she is either my
she's
sister or she is my
family
daughter or
member.
she is my mother.
family member.
Then only you can get involved into that system and that pleasure and what returns I am getting, so that those are altogether different.
So affection,
So
you
a
say.
different level of satisfaction you get out of this thinking process.
Having
Money is
affection.
going to follow automatically.
Having affection
Yeah.
for your patient is so important. So I didn't know much about you. Just I correlated your little what I knew, and it's everything is righteousness, modesty, honesty, truthfulness, having a lot of
Yeah.
patience, having passion and compassion. Thank you, doctor. Thank you for the interview.
Thank you,
I'm
madam.
sure
Thank you, madam.
all the
Nice.
audience will enjoy this and
Yeah.
learn a lot from
Thank you
your
very much.
interview. Thank you so much.